Well, new tonight, a nearly 200-year-old medical treatment is gaining new life. It uses a combination of air pressure and pure oxygen to heal the body.
Now, doctors right here in Central Florida are using the therapy to treat post-traumatic stress disorder. Fox 35's Christy Kern shows us how it works.
When you walk through these doors at Aviv clinics in the villages, prepare to go 33 feet under. Not really, but the hyperbaric oxygen therapy mimics the pressure change in a suite that looks more like a first-class airplane cabin than a treatment room.
We build pressure up as they're breathing 100% oxygen, increasing the concentration of their oxygen in their body.
Dr. Mohammed Elamir is one of the physicians here. He says people come from all over the world. Hyperbaric oxygen therapy, or HBOT, has been around for hundreds of years to treat things like stroke, traumatic brain injury, and cognitive decline. But now it's also treating psychological trauma like PTSD. And Dr. Elamir says it's taken years to perfect the fluctuation of oxygen levels.
We deliver the oxygen in a pressurized environment in a very special protocol to make the body heal itself.
A recent study followed 30 patients with treatment-resistant PTSD for 3 months. Research showed all PTSD symptoms, including avoidance, cognition and mood changes, and depression, all improved through the HBOT treatment. Andy Smith is a veteran who served in the United States Army for 17 years. He was diagnosed with PTSD about 4 years ago.
Couldn't sleep well at night, night sweats, terrible dreams. And that carried on forward, In time, I learned to just deal with it, but my wife would notice that sometimes I would whimper in my sleep.
Smith took part in the HBOT program at Aviv, where patients go for 2-hour dives. They do it 5 times a week for 12 weeks. Patients wear these masks for 20 minutes at a time during the 2-hour dives to increase oxygen levels in the brain. The idea is to generate new stem cells.
If you breathe that same 100% oxygen in a pressurized environment, like this hyperbaric suite, you can get your oxygen level to 1700. And that really gets the oxygen to the tissue that needs it.
In Smith's case, scans show as much as a 35% improvement in some areas of his brain, including significant improvements in blood flow, new nerve connections, and improved metabolic function. He says he feels calmer and sharper, remembering things like security codes for logins. And brain scans show a significant improvement in the part of the brain that controls his short-term memory. And as far as his overall PTSD symptoms,
I don't have the dreams so much anymore. And when I do have the dreams, I'm at peace with it.
Christy Kern, Fox 35 News.
The treatment is not covered by insurance. The clinic does provide free consultations. The main side effect is temporary damage to the eardrum because of the pressure change. 95% of the patients do not experience that.